At the top right, there are pictures featuring a father with a young daughter in his lap, a picture of a mother and child at the doctor's office, and classroom with diverse students. In the bottom right is the Centers for Disease Control and Prevention logo, which also shows that CDC is a part of the Department of Health and Human Services.
Hello and welcome. This presentation is entitled Childhood Lead Poisoning Prevention, Information for the Community. It's designed to inform you on the topic of childhood lead poisoning and how you can help prevent it. The purpose of this video is to show that lead exposure is a major public health problem and to highlight its continuing impact on children and adults. In this presentation, you will learn the sources of lead exposure, major short-term and long-term health outcomes of exposure, and how to help protect children from lead exposure. First, what is lead? Lead is a metal that occurs naturally in the environment and has been used in industrial and consumer products. What is lead poisoning? Lead poisoning, or lead toxicity, refers to human exposures to lead that result in illness and require immediate medical attention. Lead poisoning happens when lead is absorbed into the body over time. Children under 6 years old are most at risk. Also, if you're pregnant, lead can harm your baby.
A graphic showing a test tube of blood marked to show the amount of lead in the blood associated with harmful effects, from developmental toxicity at 5 micrograms per deciliter of blood to death at 150 micrograms per deciliter of blood.
Large amounts of lead exposure may cause death, and small amounts of lead in children ages 0 to 3 may cause brain damage, decreased thinking ability, and academic and behavior problems in school. What is blood lead level? Blood lead level, or BLL, is the amount of lead found in blood. It is measured in micrograms per deciliter of blood. Impact of lead exposure in adults and children. Children, especially those younger than 6 years old, are more vulnerable to lead poisoning, but everyone can be affected by lead. Even low levels of lead in a child's blood may cause lifelong health effects such as lower IQ, decreased growth, and decreased hearing. These effects may continue into adolescence and contribute to challenges in educational advancement. Lead exposure does not have obvious symptoms, but can affect nearly every part of the human body. No safe level of lead has ever been identified.
There are 2 transparent figures, one adult and one child. The organs in the body affected by lead are shown.
As you can see from this diagram, there are many organ systems affected by lead in both children and adults, including the brain. Lead may cause memory loss, irritability, and depression in adults. It may cause behavior problems, lower IQ, and learning disabilities in children. It may also cause high blood pressure in adults and anemia in children. Damage to kidneys can occur for both children and adults, among other affected organs.
There is a snapshot of the cover of a CDC report on educational interventions for children affected by lead. The cover features pictures of young children.
Age-specific developmental impacts on children affected by lead. There are age-specific developmental impacts on children exposed to lead starting before a child even enters the school system with difficulty listening and following instructions. When a child is in early elementary school, they are more likely to fall behind academically. Early and upper elementary school children may have trouble making the transition from simply memorizing facts to using math concepts to solve problems. In middle school, a child may have difficulty in attaining higher order cognitive and organizational skills, such as evaluation or analysis. In high school, a person is more likely to smoke, skip, or drop out of school, commit criminal offenses, or engage in risky sexual behaviors.
Images of sources of lead showing jewelry, spoons containing spices, and children's toys.
Now, we will discuss in more detail where lead can be found in our environments.
There is a drawing of a cross-section of a kitchen in a home with arrows showing the various ways lead can get into a house.
Lead exposure can come from many places in a child's environment. It can be in their food, specifically canned food, if lead solder was used, or from lead dust in the air getting into the food. It can be in the air from industrial or auto emissions and lead dust created from things such as lead paint on windows. It can get into the soil from the lead in the air or water. It can be from other sources in a child's environment, like their toys, jewelry, or paint. Lead dust can collect on windowsills, toys, floors, and even pets. Understanding all the different avenues for lead exposure in a child's life is the first step in preventing lead poisoning.
There is an image of 3 spoons containing different types of spices: oregano, turmeric, and paprika.
Lead in spices. Lead is sometimes used to enhance the color of spices like turmeric, or it is used to increase profits by adding weight to packages. In a 2018 North Carolina study, 111 of 386, or 29%, samples of spices, home remedies, and ceremonial powders were found to contain high levels of lead. The country of origin was not known for all samples, but 76% of them came from the United States.
On the screen, you can see a child playing with plastic toys and beads used to make jewelry.
Lead in children's toys and jewelry. Lead may be found in the paint, metal, and plastic parts of some toys and toy jewelry, particularly those made in other countries and antique toys and collectibles. To reduce children's risk for lead exposure, the U.S. Consumer Product Safety Commission, the CPSC, tests and issues recalls of current products that may potentially expose children to lead. Check the CPSC website or give them a call to be sure your child's toys are safe. There are many occupations and industries that are known for potential lead exposure. Some of these include automotive repair, home renovations, and work with firearms. If you are already employed or want to pursue a job in one of these industries, it is important for you to practice lead safe behaviors, like taking your shoes off outside of the home before entering. Later in the presentation, we will go over more lead safe behaviors that you can do, or you can share them with your family and friends if they participate in these industries.
Activities that may cause lead exposure include paint, and on the screen, we have 3 buckets of paint and a paintbrush.
Some hobbies and activities are known to also be a potential source of lead exposure, such as making stained glass, furniture refinishing, and hunting. There are steps you can take to help decrease your risk of lead exposure if you take part in any of these activities. Always wear protective equipment, such as an outer layer of clothes that you can remove before entering your home, car, or school. Always wash your face, hands, and any uncovered skin thoroughly after you finish your activity.
On the left, we have an image of an older front porch staircase with visible paint peeling from the wood. The right side shows a bar graph comparing the prevalence of lead paint in houses by unit characteristics, including age and geographic location.
Lead in housing. Lead hazards are created when lead painted surfaces deteriorate or are disturbed and the crumbling paint is deposited in house dust and soil. Older houses, built before 1978, are more likely to have lead paint and lead water pipes that can leach into drinking water. Renovation of older housing is becoming a common source of lead exposure.
On the right side, there is a picture of the cover of an Environmental Protection Agency, EPA, pamphlet about lead exposure in homes.
In 1996, the Lead Hazard Disclosure Rule became effective, requiring all landlords and sellers to provide buyers and tenants with lead hazard warnings and pamphlets. Landlords or sellers must disclose the presence of known lead-based paint and/or hazards. They must provide lead hazard warnings and pamphlets with a lease or sale contract. Obtain a written statement from buyers and tenants that they received a federal lead hazard pamphlet, and buyers have a 10-day window to conduct a lead test on the property. For home buyers, federal law requires that before being obligated under a contract to buy a house, including most buildings built before 1978, buyers must receive the following from the home seller: an EPA approved information pamphlet on identifying and controlling lead based paint hazards, any known information concerning the presence of lead based paint or lead based paint hazards in the home or building. For multi unit buildings, this requirement includes records and reports concerning common areas and other units when such information was obtained as a result of a building wide evaluation. An attachment to the contract or language inserted in the contract that includes a lead warning statement and confirms that the seller has complied with all notification requirements. A 10-day period to conduct a paint inspection or risk assessment for lead based paint or lead based paint hazards. And in addition, you may locate a certified risk assessment or abatement company on the EPA website by entering your state or location. You can find that link in the additional resources section of this training website. For renters, federal law requires that before signing a lease, including most buildings built before 1978, renters must receive the following information from your landlord: an EPA approved information pamphlet called Protect Your Family from Lead in Your Home, any known information concerning the presence of lead based paint or lead based paint hazards in the home or building. For multi unit buildings, this requirement includes records and reports concerning common areas and other units when such information was obtained as a result of a building wide evaluation, an attachment to the contract or language inserted in the contract that includes a lead warning statement and confirms that the landlord has complied with all notification requirements. If you have concerns, ask your landlord to get a lead hazard inspection from a certified inspector before signing a lease.
There is a picture of what paint peeling from the outside of a house looks like.
A professional renovator or home inspector can test your home for lead paint using EPA certified brands: 3M, D-lead, and if you're in Massachusetts, the State of Massachusetts lead test kits. Also, home testing kits are available at local hardware stores. You can call your state or local water department, and you can find their information by calling the EPA's Safe Drinking Water Hotline. Parents, if you or your child has been exposed to lead, you should reach out to your family doctor or your child's pediatrician immediately. At the doctor's office, you or your child will receive a blood lead test through a finger stick sample or a vein sample. If lead is found in blood, follow-up care may be recommended, including removal of lead from the environment, diet high in iron and calcium for children, early educational services, follow-up blood testing, and x-rays and chelation therapy for high levels. Lead-safe behaviors. It is important to practice lead-safe behaviors to prevent lead exposure whenever possible.
Pictures of peeled oranges.
Eating foods rich in iron, calcium, and vitamin C helps prevent the absorption of lead into the body.
A pair of hands being washed.
Frequent hand washing and cleaning of window frames and floors eliminates one of the main avenues for lead dust exposure. And if you know you have lead piping in your home, letting the tap run for 3 to 5 minutes before using it will allow the pipes to flush out the lead contaminated water.
A set of dirty work boots left outside the house are shown.
Some occupations and hobbies expose you to lead, which can be brought into your home, so creating barriers between this exposure and children, like removing shoes outside the home, is very important. Lead poisoning puts a child at high risk for developmental and physical delays. There are resources available to families that identify any possible delays to help children thrive. Head Start is an early childhood program that focuses on children's physical and mental health, nutrition, and social service needs. These programs have shown cognitive improvements in the children who are enrolled. Early intervention offers services and support such as speech, physical, and occupational therapy based on what the child needs. Your local Child and Family Connections office or your local public health department can assist you in getting a child enrolled in early intervention. Developmental screenings show a parent what their child can do compared to other children of the same age. Easter Seals offers a free online screening called the Ages and Stages Questionnaire. This screening is designed for children 0 to 5 years old. Now that we know about the adverse effects of lead exposure, what can we do about it? Knowing where the high risk housing in your community is located is important for not only current and future home buyers, but also for professionals such as real estate agents, plumbers, painters, renovators, home inspectors, and more. Encouraging lead safe practices will help decrease the potential lead exposures in your home. It is also important to research brands of spices, toys, and jewelry to know if they're safe and have passed lead standards for the United States. Check for recalls on current products on the Consumer Product Safety Commission's website or by giving them a call. Before buying or renting an older home or apartment, it is important to have the place inspected for lead hazards in the paint, dust, soil, and water. Spread word about possible lead exposures and let's help prevent lead exposures before they happen.
A group of diverse young children is shown.
Childhood lead exposure is a problem we can prevent when we know the risks and help spread the word. This presentation was developed in collaboration with the American Academy of Pediatrics. The contents of this presentation are those of the authors and do not necessarily represent the official views of nor an endorsement by the Centers for Disease Control and Prevention, the American Academy of Pediatrics, the U.S. Department of Health and Human Services, or the U.S. government. Thank you for viewing Childhood Lead Poisoning Prevention, information for the community. For questions or comments regarding this video, please send an email to leadinfo@cdc.gov and indicate community education question in the subject line. Here are the presentation references. Have a great day. Thank you for watching.